India's cancer burden is showing an alarming surge, with new data from 43 population-based cancer registries revealing that the lifetime risk of developing cancer in the nation now stands at 11%. In the 2024 alone, the country recorded an estimated 15.6 lakh new cases and nearly 8.74 lakh deaths due to the disease. While cancer is a global health concern, India's sheer population size and diverse risk factors make its challenge particularly complex. The registries, which together covered around 10% to 18% of India's population across 23 states and union territories, form the backbone of the nation's cancer surveillance system. By capturing trends over 2015 to 2019, researchers have been able to trace the evolving pattern of cancers in India, with important policy implications. Gender divide and types of cancers. Let us know about all of them in detail. The data shows that women accounted for a slightly higher proportion of total cancer cases, that is 51.1%, but a lower share of deaths, 45%. Experts attribute this difference to the nature of cancers most common among women, that is, breast and cervical cancer, which together make up 40% of female cancer cases, are relatively easier to detect early and generally have better outcomes with timely treatment. In contrast, cancers that dominate among men, such as lung and gastric cancers, are harder to detect at an early stage and often carry poorer survival rates. Oncologists point out that breast cancer, for instance, can sometimes be self-detected by women noticing lumps, while lung cancer lacks such visible symptoms, delaying diagnosis. This late presentation makes it a more lethal disease despite its relatively lower incidence compared to oral cancers. The latest data also revealed a concerning rise in oral cancers, which have now overtaken lung cancer as the most common cancer in Indian men. Although tobacco consumption has declined nationally from 34.6% of adults in 2009-10 to 28.6% in 2016-17, that is, oral cancers continue to increase. Experts suggest this could be due to the long gap between first exposure to carcinogens and the appearance of disease, as well as additional risk factors such as alcohol use. Alcohol consumption not only increases the risk of liver cancer but is also linked to cancers of the oral cavity, pharynx, stomach and colon. Regional disparities, the northeast burden. Notably, the cancer burden is far from uniform across India, with the northeastern states reporting the highest incidence. In Mizoram, for example, the lifetime risk of cancer is estimated at a staggering 21.1% for men and 18.9% for women, nearly double the national average. The region also reports the country's highest levels of cervical cancer, lung cancer in women, and oral cancers. Experts believe several intertwined factors explain this pattern. Tobacco use in both men and women in the Northeast is well above the national average. Dietary practices such as consuming fermented pork fat, smoked and salted meats, spicy foods, hot beverages, and the addition of soda in cooking may further add to the risk. High prevalence of certain infections including Helicobacter pylori, hepatitis viruses, Salmonella, typhi, and HPV also play a crucial role in increasing cancer vulnerability. This regional variation underlines the need for tailored interventions. While awareness campaigns and screening can benefit the whole nation, the Northeast requires special attention with targeted prevention and treatment strategies suited to its unique risk environment. Policy implications and the way forward. The findings hold crucial lessons for India's cancer control efforts. Strengthening screening programs at primary health centers, organizing cancer detecting camps, and ensuring timely access to treatment through tertiary centers are all the essential steps. The government's Ayushman Bharat program, already includes provisions for cancer care, but experts stress the need for more region-specific planning. For women, scaling up HPV vaccination and screening for cervical cancer is vital, given that only 2 registries reported incidents below 4 cases per 100,000. For breast cancer, expanding early detection initiatives could help reduce mortality significantly. For men, curbing oral and lung cancers requires a strong push against tobacco and alcohol use, alongside better access to diagnostic facilities. The World Health Organization estimates that between 30% and 50% of cancers can be prevented by reducing risk factors and implementing existing prevention strategies. Early detection and appropriate treatment further improve survival rates dramatically. As Dr. Prashant Mathur of the ICMR National Center for Disease Informatics and Research emphasized, addressing cancer in India will require a comprehensive approach, strengthening infrastructure, promoting healthy lifestyles, expanding screening, and enhancing public awareness. With cancer cases rising steadily, India's ability to translate data into action could prove decisive in reducing the burden of the disease and improving outcomes for millions of patients in the coming decades. That's all for now. Stay tuned to the Savera for more updates. Do like, comment, and subscribe to the channel.